This procedure is permanent. It is not the same as Botox, absolutely not, because the procedure performed here involves lifting and tightening a specific area. In Botox, we stop the function of the muscle. In this procedure, we do not stop the function of the muscle, and the results are permanent. In a person's life, a temple lift or mid-facelift is done only once. In other words, there is no need for a second repetition. I always say this, it stays as it is done. Initially, we lift a bit more, even sometimes referring to it as overcorrection. This is because the skin has a certain amount of elasticity, and it will settle over time. I have been working with this surgical method for 23 years. In fact, this surgical technique has been used in Turkey for about 25 years. During this time, I have not had a patient who needed a second lift. I don't think I'm exaggerating when I say this. Of course, patients sometimes worry, saying, let it look natural, don't lift it too much. Sometimes they say, doctor, it looks too pulled. In reality, it doesn't look overly pulled. We initially lift a bit more because there is a settling process that occurs over time. During this period, you might think it looks too lifted. In fact, we do this partly to ensure the result is noticeable. For example, a patient might say, people look and say, wow, it's lifted too much. However, after a while, it settles to a natural appearance, and the patient sees this in follow-up visits. Ultimately, this is a permanent method. Yes, there is some elasticity, but it is a permanent solution. It is completely different from Botox. With Botox, you cannot lift the brow significantly. It may lift slightly, but you cannot achieve the desired appearance or direction. Additionally, Botox is temporary. The biggest advantage of this method is that, when the correct technique is used, it delivers incredibly beautiful and satisfying results for patients.